Hi everyone, this is Janet Hale at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on January 5th, 2021. Today we have with us Amy Thorson of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department. Each of them will be talking about vaccine plans as for each of their counties. First of all, Nita, let's start off with some Rock Island County members.
Good afternoon. Unfortunately, today we are reporting 5 additional deaths from COVID-19 in our county. A woman in her 50s who had been hospitalized, a man in his 60s who was hospitalized, a woman in her 90s who passed away at her home, a woman in her 90s who had been in long-term care, and a woman in her 70s who had been hospitalized. And again, our deepest condolences go out to the family and loved ones of these individuals. That brings our total deaths in Rock Island County to 271. There are additional 49 new cases of COVID-19 in our county, bringing our total cases to 11,045. 39 people are currently hospitalized in our county.
In Scott County, there have been a total of 14,384 cases of COVID-19 in Scott County residents. We are at 153 deaths of Scott County residents, which is an increase of 6 since we last talked with you last Wednesday. We too send our deepest sympathy to the family, friends, and loved ones of those who've lost their lives to COVID.
After months of waiting and hoping, we finally have a vaccine to combat COVID-19. We understand that many of you want it now, but the mass vaccination process will take months. Right now, vaccine supply is coming into Rock Island County is very limited. All hospital and emergency medical service staff members who participated have had their first dose of the COVID-19 vaccine, and now we are working to give those people their second dose while moving into the next phase, which is non-hospital healthcare staff. Our first mass vaccination clinic for non-hospital healthcare workers will be 9 a.m. to 1 p.m. Or until the vaccine supply runs out on January 12th at the Greater Quad City Auto Auction at 4015 78th Avenue in Milan, Illinois. Vaccine supplies at this point are still limited. Masking and social distancing requirements will be enforced. Only healthcare workers with appropriate identification are eligible to receive vaccine at this clinic. Healthcare workers, as defined by the Illinois Department of Public Health, include clinicians, which is nursing and nursing assistants, physicians, nurse practitioners, and physician assistants, physical, occupational, and speech therapists, respiratory techs, dentists and dental hygienists, pharmacists, plasma and blood donation staff, morticians, home health workers, school nurses, optometrists, COVID-19 testing staff, dialysis staff, urgent care workers, corrections, nurses and aides, vaccine clinic workers, group home residential staff, environmental service and reception staff at congregate care facilities, congregate care surveyors, hospice and palliative care staff, community health care workers when acting as a health aide or health translator, we do expect to have clinics at the auto auction on most Tuesdays as vaccine supply allows, until every resident has an opportunity to take the vaccine through the phased approach outlined by the Illinois Department of Public Health. In addition, we are working out partnerships and details with pharmacies in our county and as well as community health care to offer weekend hours. More information will be available soon. These plans are still being firmed up. When healthcare workers have been vaccinated, We will move to phase 1B and have directions from the state health department on which groups will go next. These will include residents 75 and older, frontline essential workers, defined as those workers who are essential for functioning in society, which includes firefighters and law enforcement officers, corrections officers, food manufacturing, processing plant and agriculture workers, U.S. Postal Service workers, manufacturing workers, grocery store workers, public transit workers, teachers and support staff, and daycare workers. We know we have given you a lot of information here, and more details will be released as they become known. Please keep watching through our media partners, our social media pages, our websites, and togetherqc.com. And please be patient. We are all at the beginning of this month-long marathon of vaccination. Thank you.
Similar to Rock Island County, we are also hosting our first community-based vaccination clinic for healthcare workers in Scott County this Thursday, Friday, and Saturday. The healthcare workers getting vaccinated this first week are being scheduled by an appointment and include unaffiliated provider and convenient care offices, other healthcare providers working almost exclusively with the elderly and other at-risk groups, and emergency responders. As more vaccine is allocated to Scott County, our office is reaching out directly to healthcare provider offices when vaccine is available for them and assisting them in getting staff scheduled to be vaccinated at our community-based clinic. We recognize there are a number of healthcare workers in our community that have yet to be vaccinated. We have not forgotten the dental, vision, therapy, and other providers in our community. We have plans in place to vaccinate you all as enough vaccine is received in Scott County. We recognize this process is slow. Vaccine supply is very limited. It will be the biggest driver of how fast this process will work, and it is something we have no control of locally. There is no set amount of vaccine that comes to Scott County each week. Some weeks there may be no vaccine that comes to Scott County. We now have a message for you, our media partners. We have tried our best to be available and reliable with sharing information with you every week for the last 10 months. Now we have an ask of you. For many in our community, their main source of information is their local news stations and newspapers. We are getting many questions about whose turn it is to get vaccine and how to get signed up as a member of the general public. We would like to ask you to focus on sharing vaccine rollout information, especially to the older populations in our community. While we can update our websites, social media pages, and send messages to our partners as much and as often as we want, you hold the key to the messages that many in our community still rely upon. Please let the community know that you will share information when it is available. Let the community know that unless they are part of the healthcare worker group, they do not need to do anything at this time. Let them know that they can rely on your organization's articles and broadcasts to be timely and be accurate. We are finding that many in our community are listening to the national news stories and might be missing the rich local information on COVID-19 that they can find right here in our community. We are doing our best to encourage people to pay attention to the local news for local information. We would appreciate your support in this. As you hear national news stories on the COVID-19 vaccine or other topics, please reach out to us so we can help share what this means locally. For now, our messages for the broad community is please be patient. The Scott County and Rock Island County Health Departments will let you know when it's your turn. Make sure to check our websites and social media pages and watch our local news stations and newspapers. Updates will be shared there regularly. Thank you for sticking with us through the last 10 months. And as we move into the next phase of the COVID-19 response, we are grateful for your partnership. Thank you.
Thank you so much, Amy and Nita. We appreciate you sharing this information. We'll give it a couple of seconds here to see if we have any questions on the call from media partners. We do recognize there's not always brand new information that we can share with you on these days, but again, we want to make sure that we are routinely sharing what we know and what we don't know so that you can accurately respond to those questions as you receive them and put those onto your newscasts, as Amy mentioned. Okay, I don't see any questions. We're going to go ahead and conclude for the day. Again, we'll continue talking with you. We'll continue providing information out there. And we will connect with you all. And on Thursday, again, that is our intention. And we should have some additional information we can share at that point. Thank you all. Have a good afternoon.